Hi, everyone. I don't know if you guys can hear me. I'm Sahibi. I'm one of the social media managers for Future Peace Resident, and I'll be moderating facilitating this breakout room. So for now, we're just want to make sure all the programs are here. So I'm just going to go down the list. And if anyone from that program can just kind of say hello, introduce yourself, we'll just see if everyone's here, and then we can get started. So first, we have Emory.
Yep, we're here.
All right. And then University of Florida, Jacksonville.
Yep, yeah, here too.
And then, I'm sorry if I'm mispronouncing his name, Nicklaus Children's Hospital.
Yes, we're here, myself as well as Dr. Benham, the Associate Program Director. Thank you for having us.
Perfect. And then we have Prisma Health in Greenville.
We're here, thanks.
All right. And then we have University of Arkansas.
We're here. This is Hank Fair, and Liza Murray is our Associate Program Director, who's here also.
All right, perfect. And last, we have Nemours Children's Hospital.
We're here.
All right, perfect. So just to remind you guys, each program will get about 5 minutes, and I'll give you a warning at about 1 minute. So you just kind of wrap it up, and of course I won't cut you off in the middle of the sentence, but I'll let you finish whatever you're saying, and then we'll move on to the next program. And then at the end, I'll just open up the room for just any questions. So whenever you're ready, Emory, you can go ahead.
Hey everyone, it is really nice to meet you. I'm the program director for Emory Pediatrics. I'm Rebecca Sanders, and I'm joined tonight by one of our chief residents, Jason Stevenson. And I'm just going to tell you a little bit about what we think makes Emory great. We're a fairly large program. We're situated in one of the largest cities in the country, and we draw patients from all over the state, which translates into just an incredible variety of clinical experiences that you can have. Our primary training site is Eggleston Children's Hospital, and it's a very well-resourced 289 bed quaternary care center, and really gives you an opportunity to experience the whole spectrum of pediatrics and to learn from, everything from very general pediatrics to sub specialty care. And because we're big, because we're in a well-resourced and very large hospital system, it really gives us the opportunity to focus on your particular career and professional development. And whatever it is that you're interested in, we can offer some in-depth experiences in those things. As you can see, we have a number of specialized tracks, and many of our residents take advantage of those in a variety of different kinds of subspecialties within pediatrics. And then one of the things that we have is a research track. And our department is #1 in the country amongst departments of pediatrics in terms of NIH funding. And so we have a tremendous wealth of mentors and resources for our residents there. And we offer concierge mentor matching in research for every resident who wants to do a scholarly project. The CDC is also right down the street. I mean, it literally is right next to Emory's campus. And so it's a great place for those of you who are interested in public health or epidemiology. We are also privileged to care for a predominantly under-resourced, publicly insured or uninsured population. And so Emory is a great place for you to get hands-on training in how to address social determinants of health and health disparities. And there are myriad opportunities for community advocacy and engagement. And really, I just feel like the bottom line for our program is whatever you want to do and whatever it is you want to be, we can help you get there, and we can really support you in that journey. And I'm going to let Jason talk a little bit more about what Emory is like. Go ahead, Jason.
Hi, everyone. I'm Jason Stevenson. I'm one of the chief residents this year. I just wanted to highlight a couple of things about Emory and the city of Atlanta. I second everything Dr. Sanders said. Atlanta is a very diverse, very multicultural center that is a really fun city to live in. We see that in both our patient population and in the residents we attract. There's also a very large refugee population that we have the privilege of serving in Atlanta, mostly because of our Hartsfield-Jackson Airport being a major hub. Another kind of hidden, I think, benefit of the city is that we have the third largest LGBTQI plus population in the United States. And it just kind of adds to our diversity of patients and diversity of people in the city. Outside of the city, there are great kind of outdoor activities. You can go just a little bit outside the city and have great hiking, great trails if you like to do that. Lots of people go to the Chattahoochee River. And my favorite part about Atlanta is the food scene. With that cultural diversity comes great, authentic food. Buford Highway has some of the best food from all over the world that you can sample. And those are just kind of some of the best things about living here. All the big city amenities, but a nice down home community feel.
We have about 30 seconds left.
I will turn my time back over.
All right, if you guys are ready, we can move on to the next program. And don't worry, we'll have a lot of time at the end if you want to revisit some things. Yeah, okay, go ahead. University of Florida, Jacksonville.
Hi, everyone. Thanks for this opportunity to introduce all of you to our program. So I'm the program director. My name is Aisha Mirza, and I have our awesome program manager also on, Dawn DeSantis. So if she wants to say a few words at the end, you can hear from her as well. So we are located in the city of Jacksonville. We are in the northernmost corner of the state. And, I think the thing I hear from most people is, so we are at the intersection of 95 and I-10. So most people pass through Jacksonville, whether they're going to Orlando or Miami or New York or headed west towards some of the other southeastern states, all the way down to LA. So we are actually very well located in terms of being able to travel wherever you want to across the US. We are a university hospital. We are part of the University of Florida, and I think one of our biggest assets is the Children's Hospital, Wolfson Children's Hospital, which has been growing over the last many, many years. It's the area's only freestanding children's hospital, so we really have monopoly when it comes to being able to provide care for children in the entire region. We also serve a very large area, Northeast Florida, Southeast Georgia, all the way down to the Panhandle. We get lots of referrals from the Big Bend area of Tallahassee and all the way down to St. Augustine and Daytona Beach. We also serve a very large, underserved, diverse, and indigent population. Our residents rotate not just through the Children's Hospital, but the University Hospital itself, which is the safety net hospital for this area. We have been very successful in, mentoring and teaching our residents, lots of emphasis on QI, patient safety, providing high value care. For 2018 to 2020, we have the highest board pass rate in Florida. So we're very proud of that and continuously working to improve upon what we already have. There are many, many opportunities here for advocacy. In fact, one of the highlights of our program is our societal pediatrics track. which we have a lot of involvement with the AAP chapter, the SOPT. Several of our faculty members serve on different boards with the national AAP as well as the Florida chapter. We have a history of 100% fellowship matches and job placement. None of our residents had any difficulty finding jobs, even when going into private practice the last couple of years, particularly during the pandemic. So we've been very fortunate with that. And we also have a very diverse and versatile group of residents and faculty who really are the heart and soul of the program. And I think the other thing that most people note about us is that our environment is extremely friendly. We are a medium-sized program, so just large enough that there are enough. We have plenty of people, but at the same time, everybody really gets to know everyone really well. And our faculty, as well as our residents, really come from all over the world. So we are an extremely diverse program in that respect. We have, in terms of what our residents do after graduation, we have sort of a 50-50 split. If you look over the years, half our residents go into primary care and half do fellowship. All our residents are involved in QI. All of them, at least 2/3 of them, if not all, present their scholarly work at different meetings, whether it's pure research, it's QI, it's a mixture of the two, clinical cases, etc. We currently have 43 residents. We are approved by the ACGME for 46. So over the next couple of years, we've slowly been increasing our complement. We do have dedicated, as I mentioned earlier, community and societal pediatrics tracks, a global health track. We started a research track, and we just recently started a rural medicine rotation. Because we are one of the oldest programs in Florida, so we have alumni all over the country. And actually, our alumni really remain engaged with us. So I think that's just another measure of, how much they value the training that they got and the relationships that they form. And the preceptor for our rural medicine elective is actually one of our program alumni. So we're very, very happy to continue to maintain such close contacts with our residents once they graduate. We have lots of sites for our longitudinal experiences. Oh, okay. I'm almost done. And then finally, I'll just say, Jacksonville is a great city to live in, very affordable cost of living, lots of outdoor water activities, lots of water parks. So something, I think, for everyone. That's it.
All right. Thank you for that. And so next up, we have Nicklaus Children's Hospital. So whenever you're ready, you can go ahead.
Thank you. Thank you so much for having us. And my name is Beatriz Canilda Salto. I'm the program director here at Nicklaus Children's. I'm joined by Dr. Maria Benham-Turnius. She's one of our associate program directors. We're happy to have this opportunity to highlight our program. Nicklaus Children's Hospitals in Miami, Florida. We're the only freestanding children's hospital in the South Florida area. We have 309 beds. We're a not-for-profit facility, and a lot of our residents are eligible then to take advantage of the student loan forgiveness program. Because of that, we're level 1 trauma center, we have a level 3 NICU, over 40 pediatric subspecialties. And given where we are geographically in Miami, we really have a very diverse patient population. Our patient reach is not just the local Miami community, but the whole South Florida area, and really global. We have very routinely patients coming to us from the Caribbean, Central and South America. So we really do get a chance to work with patients and families from all over the world. It is an underserved patient population with nearly 70% falling in that Medicaid, Medicare payer mix. And within our hospital, because we're a freestanding children's hospital, we have the benefit of getting exposure to pathology in all of the different subspecialty areas, common bread and butter diagnoses, but also rare diagnostic challenges, all levels of acuity from primary care to high complexity ICUs as well. NCH is also the home of the largest program in Florida. We have 84 residents, so 28 residents per class and 2 chief residents. And we have 16 fellowships in our institution, and the ones that fall under the umbrella of pediatrics include adolescent medicine, cardio, PICU, ER, GI, hospital medicine, and some also AI is a possibility as well. But I really think the biggest highlight of our program is really the friendly family environment. Even though we're a larger program, we are the only core program in our institution as the pediatric residency. And so everyone really knows each other. The relationships between the faculty and the residents are very close-knit. Our faculty is very approachable, always accessible. They really enjoy teaching. They're great mentors. And amongst the residents themselves, I think it's a very supportive environment. They really form long-lasting relationships. We have residents that stay in touch as alumni for many years, and we're really proud that we've actually had lots of our residents go off and pursue fellowships all over the country and have found their way back to become faculty back in our institution. So I think that's the best evidence of really them feeling like Nicklaus Children's is their home. We have a couple of different elective tracks that our residents can fall into, including general pediatrics, primary care, acute care, and subspecialty practices. We, with the help of the associate program directors and the mentors, will help the residents choose rotations that will round out their curriculum to give them the best experience depending on their career choice. And we have over 45 electives available for them to choose from, as well as numerous opportunities for didactics, research and scholarly activities, QI, simulation lab, with increasing autonomy and lots of opportunities also for supervisory and teaching roles in their second and third year. I mentioned a little bit about our residents already. Excellent fellowship matches and job placements. Last year, our class was about 50-50 between Gen Peds and fellowships, but it really depends on the interests of our residents. And this year, our PL3 classes a lot more fellowship heavy, but they've done excellent in their matches and their job placements. And they do also present their scholarly activity all throughout the national regional meetings. Very active in multiple resident-led committees, including wellness and advocacy, global health, and many others as well. And we, of course, like all of our other programs, I think really highlight the importance of looking at applications as a whole. We really are interested in recruiting a diverse residency class that's going to mirror the multicultural community that we have in Miami as well. And there's a couple of bullets there that also highlight our DI education and opportunities for advocacy and community service. Miami is a great place to live. Awesome weather all year round, beaches and outdoor activities, great restaurants, cultural events. So it's really a great place not just to be inside of the hospital, but also outside. And I'll leave the last few seconds for Dr. Benham to say a few words if she'd like.
Oh, thank you. Thank you. Thank you again for this opportunity. So yes, I agree with everything Dr. Kunil just mentioned, and just kind of want to highlight again, the relationships that we build throughout the residency program with the residents. Although we are the biggest program in the Southeast region, really it doesn't feel like that because we have a very tight-knit program in itself, and even the faculty and the staff reflect this, as Dr. Kunil mentioned, because we have a lot of former alumni that are attendings, and we all have worked together for many years together in various roles. So it's really a wonderful place to train in a very, also, the community is diverse. The population of our faculty is also very diverse, come from multiple different backgrounds, languages, and cultures. So it's really nice to also see some of maybe your background reflected on our faculty as well. So we invite you to come and maybe consider Miami down here for your training.
Thank you so much for that. I forgot to give you a reminder. I'm so sorry.
No problem.
But we'll come back to you later if you have something more to say. So just moving on, Prisma Health in Greenville, whenever you're ready.
All right, hi, my name is Amanda Hartke, and I'm actually the new program director for Prisma Health in Greenville. Even though I'm a new PD, I've actually been the associate program director for about 6 years, so I'm excited to build on our continuing program success. So we're a medium-sized program, about 33 categorical residents total, 11 per year, but we also have 5 med peds residents per year, so a slightly bigger program in that aspect. This number really lets us get to know all of our residents. What are their personal goals? What are their professional goals? And our program is tried to be designed to put opportunities in front of them to say, what do you want to discover? How do you need to see what will be of your career? Our graduates have been very successful along these lines. We've had a board pass rate over the last 10 years of about 98%. And like other programs have mentioned, we have also had 100% match rate for all those entering fellowships. So we really do feel like we're preparing them for the jobs they want to get. About 20% of our graduates go into fellowship each year, about 30% go into academics, including peds hospital medicine, and about 50% go into private practice, sort of mirroring the national standards for the workforce. A lot of them fall in love with Greenville and come and practice here or return after fellowship to practice. We really are a resident-driven system, and by that I mean that we have one current peds fellowship, and that's DB Peds. So our residents get to take priority in the clinical care and the procedural opportunities and those one-on-one teaching opportunities from all of our faculty. Our residency is one of 9 in our hospital system in Greenville. We are a children's hospital within a hospital, and so you get to join not only the pediatric resident family, but this close-knit, supportive young professional network. Greenville itself is a small city, large town, about 68,000, but a lot of access to be and opportunities to be on that size. Cost of living here is below the national average, so we certainly have residents that not only rent but buy homes very close proximity to the hospital. Our city is young and growing. There's a ton of access to outdoor activities. It's a day drive to mountains or beaches, and a very active population. Our residents get together often outside of it, and their social committee is always finding a new venue every week to tell me I need to try then. Our pediatric hospital is actually the only children's hospital in our region of the state, and also has a catchment area that pulls from North Carolina and Georgia. So we see a lot of unusual and sometimes low access to care populations that really give our residents that diversity of clinical experience. Our pediatric hospital, our pediatric clinic is the largest Medicaid clinic in the state. Almost 90% of our patients are uninsured or underinsured. And within those, about a third of our patients self-identify as Latinx, about a third as African-American or Black, and we have over 26 primary languages spoken. Not only that, we are now a center for unaccompanied minor immigrant care. So we really have a lot of options for how we serve our community. We're also working and continuing to help our own residency and our faculty reflect that community and support them. Our residents come from all over the US and a wide range of educational and life experiences. Many are first generation medicine, first generation college, or entering medicine as a second career. We're continuing to recruit, support, and help retain residents from historically minoritized groups, and have really continued to grow our DEI efforts in education. We have recently a funded URM scholarship. We have campus-wide DEI mentorship programs and committees. And we were honored to recently have Dr. Rhea Boyd come and speak to us on the 3-day professorship on racial equity. I now want to turn it over to our one of our APDs, Dr. Mark Crom, to tell us a little bit more about our curriculum and our academics.
Thanks, Amanda. So when I talk about our curriculum, really it's designed to give our residents exposure across the subspecialties by the end of their intern year. So that's going to mean in the inpatient setting, we're going to be helping you admit not just the general pediatrics patients, but to the subspecialty services right away. And first year pediatric ICU and NICU months, so that you'll be able to tell the difference between sick and not sick right away. So that when you're the senior resident in-house as a second year, you'll have that graduated autonomy that our residents are looking for. Our curriculum is also structured for your flexibility and your balance. We recently looked into moving to an X+Y system, but already our program is balanced 50-50 between outpatient and inpatient experiences. And so you're going to get to learn from the subspecialist in the clinic and in the hospital. And our residents really enjoy that type of learning. That also gives our residents opportunities to try to have some work-life balance. It's hard to be a resident, but we're giving you multiple opportunities to have rotations free of call or overnight responsibilities. And then every month we have a monthly town hall where our residents get together with program leadership and really talk about what's going well and what's not, so that we're able to make changes right from our residents in the moment and continue to make those changes throughout the year to improve their rotational experiences. And then for our board PEP and kind of educational curriculum.
30 seconds left.
Perfect. We still have a lunch lecture model, and we kind of focus on quick high yield talks throughout the month, structured in one subspecialty topic. And we'll go through that curriculum twice during your residency time. And just like Amanda mentioned, that will give you the ability to not just learn how to pass your boards, but also learn from the subspecialists about how to take the best care of your patients. And we know our residents really leave our program excited about being excellent general pediatricians, ready for the next phase of their career, whatever that may be.
Right. Thank you so much. So moving on, our next program is University of Arkansas. So if whenever you guys are ready.
Trying to get my mouse to work to unmute. I'm Hank Fair. I'm the program director at Arkansas Children's Hospital. And joining me tonight is Liza Murray, who is our associate program director for resident wellness. And we will just tell you a little bit about Arkansas and about Children's Hospital. We are a large children's hospital in a medium-sized town. So we have 270 bed hospital with essentially every specialty, level 1 trauma center, level 3 NICU, that pretty much all the neonates get, or most of the neonates get referred to around the state. We have pretty much every specialty represented. So you'll get a lot of experience with a lot of different things. We're a medium-sized town, which makes it easy to get around town. It takes me 15 minutes to get to work, and I live on the edge of town. We made somebody's list of top cities, medium-sized cities to live in, and I can't remember whose it was, but we made it, and it was because it's easy to get out of town, apparently. So there's a lot of stuff to do around Arkansas. You can go hiking. We have national scenic waterways. We have mountains. We've got all sorts of stuff. So it's easy to get out and do things around here. We take 25 categorical peds residents a year, and either 4 or 5 med peds and 1 child neurology resident each year. So we have a full complement of between 95 and 100, varying from year to year. Our goal for our training program is that we're training people to be general pediatricians and pediatric specialists in Arkansas and this region, because we are the training center for this state and for a lot of this region. That's where a lot of our residents come from. About a third of them come from Arkansas, about a third of them come from the region, and about a third of them come from the rest of the nation. People go into, it's pretty much even between specialty and general. About a third of our residents go into general community-based pediatrics. 30 to 40%, about 20 or 30% go into academic pediatrics or hospital-based pediatrics, general pediatrics, and then about 30 or 40% go into a fellowship. We have 12 fellowships now. I'm sorry, 11. We're working on a couple more. And so you'll get to see a lot of different things here. Patients are referred in to us from all over the state. And so you will get to see a whole lot of things here. If you're looking for a good program, you want a place where you'll have faculty who care about you and where you'll get to see a lot of interesting things. And we have that here. Our faculty work very well with our residents. Our residents work very well with each other. And it's a nice community sort of spirit that we have here. And now I will give it to Dr. Murray to see if she has anything to add.
Yeah, hi everybody. So just kind of second everything that Hank said about our program, but I think it's really interesting being in a place where you're the only children's hospital in the state. We're really intertwined with the health of the state population, and you can have kind of a big impact working within the hospital. The hospital mission is not just to treat the patients who come into the doors of Arkansas Children's Hospital, but really to make an impact on the health of children in Arkansas. And so that really kind of permeates the culture of the residency and the residents. We had some marches to the Capitol. I don't know if y'all saw some of the troubling legislation coming out of Arkansas, but we have active residents. We encourage residents to be advocates inside, for their patients in multiple ways. So it's a great program, great hospital that's making a lot of impact in the state of Arkansas.
And we'll let you have some extra time.
Oh, that's perfect. Thank you. All right. And we're moving on to our last program of this breakout room, and that's Nemours Children's Hospital. So whenever you guys are ready, you can go ahead and start.
All right, everyone. Well, good evening. My name is Corinne Bria. I'm one of the 2 associate program directors at Nemours Children's Health. We're located in Orlando, Florida. With me here tonight, I have one of our 3rd-year residents and rising chief residents, Dr. Elliot Griffith, and I am so thrilled that we can join you. You may be thinking to yourself, are you in your car? Yes, I am. I'm absolutely in my car. My oldest son has basketball practice from 8 to 9:30, which was perfect timing for me to have a few free moments to spend with you all. I have 3 younger children in addition to the 13-year-old. So we could either be doing bedtime together or I could be sitting with you in my car. And I thought the car was definitely the better option. So let me tell you a little bit about our program. We are young and we are excited. We have 3 full classes of 12 residents for a total of 36, and we will graduate our first class this year, which is so exciting. We are built on the foundation of education. We constantly are saying education over service, education over service. It is really something that we live by. We are lucky that when our hospital leadership was both deliberate and intentional about recruiting faculty who were deeply invested in developing education, medical student education, resident education, and very soon to be fellow education. So this is really one of the pillars of our program. Nemours Children's Health is located in beautiful Lake Nona, which is within the metropolitan area of Orlando. I don't think I have to tell you much about Orlando. We're about 30 minutes away from the theme parks, Disney and Universal. We're about 30 to 40 minutes, depending on how fast you drive, from Cape Canaveral and the East Coast beaches. And then we're about 2 hours away from the most beautiful white sand beaches, I would argue, in the country, but definitely in Florida. And so there's so much that can be done. There's so much to do. We have sort of the way that we approach education is we want to stay true to the tried and true methods that work, but we also want to be innovative. We want to be nimble and we want to pivot. We want to bring education to our residents differently, really relying on what works, but then also thinking, okay, how can we make this better? How can we make this different? One of the ways that we do that is we do have traditional call months, but when you are not on call in the hospital, you are not rounding, you are not being pulled in for random calls. That time is truly your own. And we have some of our residents have done a lot of math. And so they have calculated how much time they're in the hospital, how much time they're out of the hospital. And it really is an equation that really works in the favor of our residents. When we think about things like individualized curricular electives, this is something we spend a lot of time on. We don't have tracks, and that was a deliberate and intentional decision. We're nimble enough to allow our residents to have both the robust mentorship and the elective opportunities to support any of their career trajectories. So we think of the idea of tracks as more limiting, and we would like you to have the freedom to sort of, with the guidance of your mentor, really choose those trajectories that best suit your career. With that being said, we have a lot of innovative curricular aspects. We have the Nemours Academy for the Master Educator, and this is a program that runs every year that really focuses on teaching our residents how to be master educators. We have the Quality Champions program. That's a program I'm participating in right now. So I'm immersed in the IHI modules and quality improvement. We have an innovative morning report, and then we also have Friday workshop style education series, which incorporates simulation, which is a fan favorite. We have a robust advocacy, well-being, DE&I curriculum. And please, 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 if you have the opportunity, join us on Instagram. Our residents have done an amazing job with the Instagram. I joined Instagram because of them. I'd never done Instagram before. I'm an old lady. And they do such an amazing job. So if you take anything away from this discussion with Elliot and I tonight, please check out the Instagram. Please join us on this journey in recruitment. We're very, very excited to be here with you.
So I'm Elliot. I'm one of the third-year residents, and just to kind of highlight a couple of things that Dr. Bria had mentioned, I'd probably say like the biggest thing that really drove me to come to Nemours is a few things that she mentioned. Education over service is absolutely key and something that the program really strives for. And then in addition to that, just the innovative nature, essentially, that she was really describing. So the fact that we are such a new program, it really allows for a lot of opportunity to kind of like curve out and just kind of design your own path during residency. So myself, for example, I'm interested in cardiology. So I'm able to create these electives that weren't necessarily created before, just because it's an interesting niche to myself. And for another example, I guess one of my co-residents who's interested in ICU is able to do a transport elective, a procedure month, and those kinds of things, just to kind of really, I guess, guide her own interests and that kind of thing. So absolutely, I second everything that she said. I love it here, and I wouldn't trade for the world.
All right, guys. So now, thank you everyone for all the great information about all the programs. I'm just going to leave the room open for any questions from any of the applicants. And if no one has any questions, one of you I can just ask some quite general questions that I've been writing down. So go ahead. I don't want to waste anyone's time.
I have a general question for all the programs. How do you guys see your programs changing in the next 3 years? Whether, it's you guys are coming up with a new fellowship. I know some programs mentioned that, or new wing in the hospital, or transition to X and Y program. Just wondering how to see the program adapting.
I guess I'll go while other people are thinking of, how to answer your question. So for us in Northeast Florida, because our region is growing, we have had over the last several years, lots and lots of migration from South Florida, because we are in this little geographic niche. We don't get hurricanes. And so because of the weather, because also Northeast Florida, the cost of living is also very reasonable. So our children's hospital continues to grow. We are in the process of building a critical care tower that will be ready by mid-January to mid-February. The NICU, PICU, everything is going to move in there. And the goal is that ultimately in the next several years, Wolfson Children's Hospital will become the largest hospital in the state of Florida. So we are also, the mission of our hospital and our program really is also to treat the children of not just Florida, but with a particular focus on Northeast Florida and Southeast Georgia. That is our population, and really to focus on population-based health and child rights, advocacy, things of that nature. And that's what we focus on in our program too.
I'll just jump in real quick. For Greenville, I think that, I think every program and every applicant, if all of us can't say we're all adaptable at this point in the last 2 years, I don't know any other profession that can't say that. But for us, I think it's really how you deliver education in all the COVID restrictions and all the gathering restrictions, how you create those connections in those times, and trying to be creative and really make learning interactive and not lose those patient interactions when you're behind mask, and trying to pull all our faculty into those moments, just as we do for our residents.
I'm going to chime in and just kind of hedge on the question, but it's really hard to anticipate changes when a lot of the changes are resident driven. And so when you have different residents with different needs. You can, you want to be an adaptable program. And we, you know, looking back 3 years ago, we couldn't have necessarily anticipated some of the changes we have now. Like right now, my position is brand new, the Associate Program Director for Wellness. Like that was not something that was necessarily anticipated, but it grew out of resident initiatives and faculty initiatives. We're doing additional quality improvement projects to do that kind of looking at the education curriculum, but we really, really appreciate the input of residents to kind of not force, but help us with those changes. And so it's hard to say exactly what's going to change because we need residents to tell us where we need to get moving.
I absolutely agree, Dr. Murray. I think that's a great point. Is that some of the most exciting changes that have come in our program have come from resident suggestions. And so it is sometimes hard to anticipate. I will say for Emory, something I know that's going to happen is that in 2024, we are going to move into a new hospital. And that's tremendously exciting to all of us. And our institution has done a fantastic job of involving program administration and residents input into how that hospital is going to work and what our workspace is going to look like. And so that's pretty thrilling for us. But also we just intend to kind of continue to build upon the strengths that we feel like we have in terms of research, in terms of advocacy, and in terms of sort of specialized education for our residents. And we're continually kind of having an ongoing dialogue with our residents about what can we do to support your education and improve the training experience.
And just one thing about us is we're adding fellowships, which is very exciting. But we have also done a tremendous amount of planning within graduate medical education to ensure that fellowships add and contribute to our resident education, but do not take over or sort of take away from the resident education. So one of the ways that we have done that is we have actually been involved. We, as the leadership within GME, have been involved in helping to plan and prepare for the entry of fellowships into our hospital. And this way we can provide, fellowship will provide that extra level, that extra layer of mentorship, of education, without being something that deters or detracts from the residency training.
Just to kind of like chime in as well, and I agree with what everybody has said. I feel like everyone's goal is each year to improve and continue to grow on the strengths that we all have as programs, and we certainly have learned to be very adaptable this past year. At Nicklaus Children's, 3 years ago, we just actually moved into a new bed tower that houses all of our critical care units, and the construction, kind of like the highways in South Florida, continue. And we are moving on into the construction of a new surgical tower. And so we are, on the physical plant side, continuing to grow and move into new spaces. But we also are looking to add a couple of new fellowships. This past year, we added pediatric GI, child and adolescent psychiatry and genetics, and looking to potentially add the next one that's under consideration is Peds Hemonc as well. So something that we also want to grow as our graduate medical education department grows as well. And I know that we're wrapping up on time, so I'll close with that.
Thank you so much for all those answers.
Just as a reminder, these sessions were recorded, so we will post them shortly, and the infographics will also be posted, and they have the email in there. So if you have any questions specifically for each program, I'm sure they're more than okay for you to email them. So yeah, I think we'll go back to the main session soon. So hang tight.
Thank you again for the opportunity. Thanks all and good luck.